I'm John Sims. I'm a electrophysiologist at Trinity Mother Francis. I grew up in Houston. I moved there when I was about 8 years old and lived there until I was in high school, and went to Nashville for college at Vanderbilt, and then on back to Texas for medical school and training. But I came to Tyler in 2008. I think parents have a big influence on you. Certainly, my mom had a big influence on me. In terms of how you treat people and how you address people and how you care for people and how you approach yourself in the world, I guess. The idea of being able to help people and the idea of being able to interact with people on a day-to-day basis and get to know your patients and become a very important part of their lives. So that was very attracting. And then I think in addition, electrophysiology sort of offers, in many instances, a chance to literally fix people. Sometimes people will have arrhythmias that you can go in and fix, and they're back to normal and go on and live their normal lives. So that's pretty gratifying as well. It's a very challenging field. It's never the same. Every case is different. There are some cases that are routine, but there are other cases that are not. We focus a lot on atrial fibrillation, which is a problem that 3 million people in the United States have. That's the main thing that we do. We ablate atrial fibrillation. We try to get rid of the focuses that cause atrial fibrillation. It can be challenging at times. Sometimes people require more than one ablation. Sometimes they require cardioversions, medicines, etc. But if you can help these people, their quality of life is greatly improved and their risk for stroke is reduced and so forth. So that's very gratifying and appealing. Taking care of patients is a two-way street. I'm not a dictator. I don't come into a patient's room and demand this and that. What we try to do is we try to educate patients, and our field is something that requires a fair amount of explanation. Some of these things are sort of hard to grasp, so the first thing that we do is we try to outline to the patient what exactly the problem is in terms of getting it down to layman's terms, so they can understand and make an informed decision with me in terms of how to manage best their disease process. So I feel like it's important to develop relationships with patients, and a lot of times, even though I'm in a procedural field, when I first meet a patient, I don't necessarily walk in the room and say, let's set up your procedure for tomorrow. I think it's best to sort of develop a relationship over many office visits and sort of get to the point where we're comfortable with each other before we actually go do an invasive procedure if it's necessary. So that's kind of my philosophy on taking care of patients, but it's an honor to take care of patients, and hopefully we'll never lose sight of that despite all the changes in medicine.